Welcome back to our series LCME and Me to help directors of courses and clerkships know what they need to about LCME accreditation. Today, our topic is objectives. So we're going to cover what is the role of learning objectives in the curriculum and how does LCME see that, and what are the different types of objectives and how are those different objectives interrelated and connected. So I'll start out by emphasizing that learning objectives really are the foundation for the entire curriculum. So this giant foundation of our curriculum is really built on the learning objectives. So they're integral. LCME has an element, 8.2, that talks about the use of the medical education program objectives. And it says that the curriculum has to use program objectives to guide the selection of curriculum content. In other words, the objectives should drive the content, not the other way around. We don't create objectives to fit content. We say, these are the objectives. This is the things that the students need to be able to know or do or understand, and then the content flows from that. In our DCI, that document we talked about in the other episode, we're going to be providing them with an example of how the program objectives are used to guide the selection and placement of that content, further emphasizing how the objectives should drive the content. And so as we think about learning objectives, there's really different levels of learning objectives that we talk about. So we talk about program objectives, which are objectives for our entire curriculum that govern all 4 years of the MD program. Then we have course objectives. So that's objectives for a specific course or a specific clerkship. That's guiding what's going to happen within that course or clerkship. And then there's session objectives. So those are objectives for an individual learning activity or an individual teaching session. These are objectives for a lecture or workshop or case discussion. And so we have different levels of learning objectives that are all important. So starting with that highest level of our program objectives, our objectives for the entire curriculum, our program objectives are organized into 6 big buckets. So we have medical knowledge with 4 different program objectives that fall within that bucket. Patient care, we have 6 different program objectives. We have 3 for communication and interpersonal skills, 3 for systems-based practice, 5 for practice-based learning and improvement, and 5 that speak to professionalism. And I've just put the abbreviations here, but you can see the full list of how the program objectives are worded for each of these. So in total, we have 26 program objectives that govern everything that happens in our curriculum. And so at this link, you can see the full list, see exactly how it's worded, and see them organized by those different 6 big groupings. So the LCME has an element that talks about program objectives, and it emphasizes that these need to be known to all of the students and faculty. So we need all of the people that are involved with our curriculum to be aware of these learning objectives, because again, these are foundational. These guide everything we do in the curriculum. So now transitioning to that next level of objectives, the course objectives, I'm going to give you a question so you can assess yourself, see what you know. In addition to the courses and site directors, which obviously need to know the learning objectives for a course, who else needs to know the learning objectives for the course? Who else needs to know the course objectives? So a few different options here. Is it faculty who teach? The faculty that might be involved in giving lectures or precepting? Is it the faculty who assess, who might be writing test questions or filling out an evaluation of a student? Is it the students themselves? So thinking about that, those options, do you think it's group 1 and 2, group 1 and 3, groups 2 and 3, or all 3 groups? Give you a second to see what you think the answer is. It's all 3 groups. So the faculty who teach, faculty who assess, and students. So again, coming back to the DCI, that big document, we're going to be describing how learning objectives for each of the courses and clerkships are disseminated to those groups. So we have to say, how do we make sure that, number 1, the medical students know the learning objectives for each course? Number 2, the faculty with responsibility for teaching, supervising, and assessing. And then 3, we didn't talk about it, but also residents who are involved in any of those activities also need to know the learning objectives for each course or clerkship. And I can imagine that during an LCME site visit, hypothetically, an LCME site visitor could ask, how do you make sure that your faculty that are teaching in your course know the course objectives? And so as a course or clerkship director, think about how you might answer that question. Okay, another question to test yourself. So which statement best describes the relationship between program objectives and course objectives? So we talked about two different levels of learning objectives. What's the relationship between those? At least the way the LCME envisions it. Is it course objectives should be derived from program objectives? Is it the opposite, that program objectives should be derived from course objectives? Is it that those two should be identical, or that they should be interchangeable? What do you think? Well, it's really that course objectives should be derived from program objectives. So we said that learning objectives in general are the foundations of our curriculum. Everything should be derived from the learning objectives. And we said objectives should drive the content. Well, to take that a step further, our program objectives really drive the course objectives. So the program objectives should be used to shape what are the objectives in those individual courses. In element 8.2, the LCME talks about that for each required course and clerkship, the faculty that are responsible for that have to link the learning objectives of the course, those course objectives, back to the program objectives. So we have to have clear linkages between course objectives and program objectives, or objectives for the entire curriculum. In our courses, we do it much like this. In the syllabus for each course, there will be course objectives listed, and then from each course objective, it has a direct link to these are the program objectives that course objective is helping meet. So in this case, medical knowledge 1, medical knowledge 2, and patient care 4. So that's how we show that link to the faculty and to the students. In the DCI for the same element, we're going to be describing how that linkage is then reviewed, which is something that curriculum committee does when they review each course. So let's think about the relationship between these different levels of objectives. So we said that program objectives drive course objectives. Well, course objectives in turn then drive your session objectives. So your objectives for individual lectures, individual workshops. And then that's really driving the content for that individual session or lecture. So that's how the different levels of objectives should be related as they are used to drive at the next level. But it's also important that we have the linkages back. So the session objectives need to then be clearly linked back to the course objectives. These session objectives are going to help meet this one or more objectives of the course. And in turn, the course objectives are helping meet those program objectives. And so that linkage needs to be clear as well. And this is important. In our accreditation review back in 2018, for this element, 8.3, which talks about objectives, we were marked as unsatisfactory. And the LCME commented that some of the session objectives were not in the curriculum database, not linked well enough to course and clerkship objectives, not linked to the program objectives. And so that's something that we've worked really hard on since then to clearly have those linkages and make that very clear to everyone that's involved, make it very transparent in the syllabus, and make sure that those linkages are both always present and always communicated well. And that really speaks to the take-home points from this session is when we're talking about objectives, whether we're talking about program objectives, course objectives, session objectives, it's really important to have clear linkages. How did each of those relate back to the other levels? It's also important that we have really consistent communication so that all the people that are involved in the curriculum, all the people that are involved in teaching and working with students, including the students themselves, understand those objectives. As always, if you have any questions, I'm always available. You can reach out.